You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, cosmetic, dental implants, and cosmetic gum surgery. With us, we have an expert on the topic, periodontist, Dr. Boltchi. Dr. Boltchi, welcome to the program.
Thank you, Randy. Thank you for having me.
So before we get into today's topic, I have a lot of questions. You brought some pretty good photos there,
Yes.
and those are like smile makeovers. But tell us a little bit about your practice. As a periodontist, what do you do? I mean, what do you spend most of your time doing?
Well, you know, Randy, we have a whole variety of patients who come to see us. We have young individuals who come and see us for cosmetic gum procedures like gummy smiles, or if they have got recession, they come in, gum recessions come in to get those treated. We have middle-aged patients who come in who've got infections or gum disease, bad breath, and we treat that. And then we have patients who come in who may be even older and who have needs as far as replacing teeth, if they're losing all their teeth or have lost all their teeth. So it runs really the whole age spectrum as far as the patients that we treat.
So most of your patients are referred by general dentists, is that right?
Yes, because we are a specialist office, the majority of our patients are referred to us by their restorative dentist or by general dentists or by their orthodontist or by other oral surgeons. However, we also have a variety of patients who come to us that are self-referred. That means they have heard about us through their friends or family or other sources, and they come to us. So, but majority of patients at this point are referred to us by their dentist.
You're a teaching center there. What do you do?
Well, I've always been involved all my career in academics, and that's my background in teaching. And so when I went 100% into private practice, I still kept that aspect of it. So I do lecturing to other dentists and other specialists, teaching them the procedures that we do. And we have just started doing this out of our own office as well.
What is your topic? I mean, if you had to say, what is the topic? What are you teaching these guys?
The topic that we teach typically is mostly related to cosmetics. That means the procedures that we do related to gum surgery or dental implants in the cosmetic zone or in the aesthetic zone.
So the gums, is that what we're talking about here as a periodontist?
Yes, that's our main focus, and then obviously dental implants and gum surgery, both of those are encompassed.
We've had different guys on the show over the years. I've never had anybody talk about cosmetic dental implants. And you were saying that I guess it's technically demanding to make it look beautiful, to make it look right.
Yes, and when dental implants were first developed, they were developed mostly for patients who are edentulous, and they were done in the back part of the mouth, where basically functionality was more important than cosmetics.
Like eating and chewing. And
as long as they worked, it was fine.
All right.
But then as they became more and more successful, then we started placing implants in the front areas of the nose where they were visible.
All right.
And the problem is that that's very challenging because not only do they need to function, but they also need to look completely inconspicuous. Nobody needs to know that they're dental implants.
All right, all right.
But basically...
So you actually can match them up even in the front, even if it's just one tooth?
Absolutely, absolutely, yes. And the trick there is not just to match up the crown of the tooth, but also to match up the gum tissue and the underlying bone so it looks very natural and nobody can know that it's a dental implant.
Okay, good. So let's start then with, because we're going to talk about cosmetic dental implants, but cosmetic gum surgery. What defines it? I mean, what are the categories within cosmetic gum surgery?
Well, cosmetic gum surgery can be a variety of procedures that we do. Basically, if you define what the aesthetic zone is the zone that's the visible zone. It's
the
a zone
aesthetic
that,
zone.
Yes.
Okay.
When patients smile, that's what's going to be visible to another person at a social distance.
Okay.
And the procedures that we do are the cosmetic procedures, such as gummy smile. That means when a patient smiles, the patient is showing too much gum tissue when they smile. If you want a slang term for it, would be a horsey smile.
A horsey smile, okay.
With some people may refer to it that way. That is one aspect. Then on the other hand, we have people who have too long of a teeth because they have got gum recession.
Gum recession.
And gum recession is an anatomical problem.
Is that just from brushing, by the way?
It can be both. It can be from brushing, can be from a bad bite, but it can also be related to disease processes.
Interesting.
And part of it is genetic, obviously, as well.
Okay.
But that's the other aspect that we treat. And those are the two main categories for cosmetic procedures that we treat.
The gummy smile, is it common, by the way? Gummy smile? A lot of people out there with gummy smiles?
Well, it is relatively common, but you wouldn't know it by just looking at your friends or family members, because a lot of people who have gummy smile have adjusted their smile so that they don't smile as big, so that they don't show that they have a gummy smile, because it doesn't look very flattering, and it actually makes them look very immature a lot of times.
Are they self-conscious about it, by the way? Gummy smiles? I mean, when on the consult,
absolutely.
Do they confide in you?
Absolutely. Patients come in just for that, and when afterwards they're done with the procedures, when they see their natural teeth that are actually hidden away under their gum tissue all of a sudden being exposed, it's a life-altering experience for them. We had one young lady who we did this on, who was basically going to job interviews after her college, and she was being regarded as too immature.
Really?
And because she had a lot of gummy smile. And someone told her about us and the procedures we do, and she came in, and after we did the procedure, we just gave her a mirror, and she looked at herself and she started crying. And then went on to get a wonderful job and became successful.
Oh, because you took care of her gummy smile?
Well, I think that just built her confidence and made her basically look more mature, and she was more confident going into this. But let me show you an example of a procedure that was done similarly.
Okay.
So this is a patient, and this patient here, as you can see in the pre-operative picture of her smile, you can see how much gum tissue she's exposing when she smiles high enough in a normal setting. This is not her laughing, this is her actually smiling.
So her teeth appear to be just too short, but
yes.
That's not the case.
No, her teeth are, she has got her whole beauty of her teeth, and they are just hidden under the gum tissue. When we're looking at this, the options that this patient obviously has are just to go in and just to literally remove the gum tissue.
Okay.
But the problem with that is that two things. One, if it's not done in a specific way, then it's not going to look natural and attractive to the lay eye or at a social distance to someone who is looking at her. The other aspect is if you just remove the gum tissue and do not address the underlying foundation, which is the bone, then everything is going to rebound. Right. We, in our office, we get a lot of patients referred to us as second opinions who have had a procedure done a year ago or 2 years ago, and everything is back where it used to be. Because
so the gums drop back down?
Yes.
Interesting.
If the procedure is not done correctly and the foundation underneath is not addressed, which is the bone, then everything will rebound. The other thing is that when this procedure is done, we follow very, if you want, artistic principles, because we look at this as far as when we scallop the gum tissue, it needs to be parallel to a line that you draw between the patient's line, the interpupillary line. And also the proportions that we try to create. We try to create teeth that are in a golden proportion. Golden proportion stems from the ancient Greek, where they found that certain things that had certain proportions to each other appeared attractive to the eye.
Okay.
And so these are the principles that we used to follow when we do these procedures.
So not all dentists are doing it the same way, the gummy smile?
No, absolutely not. If you go to a dentist who is not properly trained or has not the expertise to do this, and that's what we teach in our courses, obviously. Okay. If they don't have that experience, then they might just remove the gum tissue and not address the underlying foundation and not remove the gum tissue according to the aesthetic principles that need to be followed to make it look natural and attractive appearing.
You say your wife calls you like a perfectionist.
You have to be a perfectionist in order to do these things the way we do it. If you are a perfectionist, it's hard to shut it off when you go home. I wish I could, but
so you go home and you're talking about gum still?
Well, or
sometimes.
I'm a perfectionist in my personal life too, which I need to try to shut off.
Okay, good. So that's what you're looking for in somebody. Okay, so let's take a look at the before and after. Okay.
So if you look at her before picture, you can see that, and then if you look at the after picture, you can see that not only do her gum tissue looks beautiful, it basically fits in her face or in her smile. Those don't look like the
same teeth. Those are the same teeth?
The teeth are the same, except the teeth have got, if you look at her before pictures, they have got a little malformation to them. They're not formed properly in the
front two
edges.
Teeth, yeah.
Yes. And so they have a little bit of bonding, but it's very, very minor. This is something that her dentist did. So just by minor bonding.
So you work together with her dentist?
Absolutely. Absolutely, yes. We do these procedures.
So you don't have to switch dentists to do this. If somebody has a dentist, they work together with you to do these type of procedures?
Absolutely, yes. Okay. What we do is that we go in and we work with their dentist and we make suggestions to their dentist. We'll say, we fix these gummy smile issue. It would really benefit this patient if they had a little bonding on their teeth to make their teeth look even prettier.
It looks like a beautiful woman's smile.
Absolutely, yes.
Rather than just a kid. I mean, this looks like a little kid.
Yeah, and this is just a photo of her smile, but if you look at actually her smile as it frames in her face. You can see here, this is her picture before.
Yeah.
And you can see how actually young she appears just because of that. And then this is her picture after. You can see
Looks
how
very
nicely
nice.
it fits in her smile. Now she's a beautiful, attractive
Was she
young lady.
self-conscious about her gummy smile?
Absolutely, yes. This is something, she said, this is something I've always hated. Let me show you a second example of a similar situation, but a little different nuances here. This one, if you look at it, the gummy smile is still there. You can see the gummy smile, but it's not as obvious as in that previous
Pretty nice
patient.
smile, though. Pretty nice smile on before.
Yes, if you look at it from a lay perspective, from a social perspective, it might appear as a smile to you that's acceptable.
Okay.
But this patient really hated her smile and she didn't like
Really?
it.
Okay.
Because she showed, not only did she show a lot of gum disease, but also she's got an implant here that has an infection. You can see this little bubble here on the gum tissue, which
That's on the top right tooth?
Yes.
Okay.
She's trying to cover that with her smile, even as I'm asking her to smile larger or bigger. But wait until you see the after, and you can see how the small nuances that we do dramatically change the situation.
Okay.
And you can see the after picture in her case, and now
Nice.
she has a new smile, basically, not just with the gum tissues that have been recontoured, but she's got some veneers on her teeth, and she's got a new implant with a new implant crown. And this dramatic change in her smile, although in her before picture, just like you mentioned, it might just appear as if being nuances
Well, they
or an
also look
acceptable
like short
smile.
teeth. I mean, compared to her after, I mean, huge difference.
Absolutely. But the length of their teeth was there. It was just hidden under her gum tissue.
If you have a gummy smile, what do you ask the dentist as far as qualifications? I mean, do you have a bias? Do you think it should be a periodontist?
Well, obviously I have a bias, and obviously periodontists are trained day in, day out to do these type of procedures. We focus only on these type of procedures. We don't do anything else.
Because general dentists can do this as well.
Absolutely. General dentists can do it, and there may be general dentists who
I mean, they're allowed to do it, I should say.
Yes.
Right. Okay.
Yes. And there are general dentists who are well trained enough to be able to do this. I myself have trained general dentists who have become really good clinicians being able to do this. But if you look at just the general population of dentists, then the majority of general dentists are not trained to do this properly.
So what do you ask them? I mean, what should you ask them?
If you go to your dentist and want to know if they do these procedures, ask them how many of these procedures they have done. Ask them about their long-term stability of their results. Because the most important thing is not just the immediate result that you basically see, because that's something you can see in a lot of before and after pictures. But to me, the most important result is how to maintain this long-term, the stability
Because
of
if
it.
you just go in there and cut the gums, like you say, they will come back down.
After 1 year
Is
to
that
2 years,
right?
yes. It will come back because you have not addressed the underlying foundation.
So there's a lot of technique. I mean, this is highly technically demanding. I mean, in the
Yes.
world of dentistry, you could bore me out of my mind maybe on what goes into creating this. Really?
Yes, we give all-day courses on these types.
Oh, is that right?
On this procedure alone, yes. And to the patient, it doesn't appear that way because the patients can come in and it's a procedure we do in our office at about 2.5 hours, and that is it. They have some swelling, but it's not a painful procedure at all. They can go about their normal lives.
So they don't have to miss work or anything like that? I mean, they could go back to work the next day?
Absolutely, yes. They can go back to work the next day. They really, the only day they need to take off is the day of the surgery.
And sedation. I mean, you do IV sedation at your...
Yes, majority of our patients are sedated, and that makes it much more comfortable for them. And they can then, one of the best things about sedation is that they don't remember anything of the procedure.
Is that right?
So they go to sleep, they wake up, everything is done. Majority of patients who we sedate, what we hear is that the last thing I remember is you starting the IV line, and I don't remember anything else. And they wake up, they go home, it's not a painful procedure, they have some swelling, they're going to be in a little bit softer diet, what I call a semi-soft diet, for a week or so, but they can go to work, to school the next day. All I ask them is not to work out for about 3-4 days, and that's usually not a problem for the majority of patients.
Okay, good. You have more photos? What else you have?
Yes. Well, the next procedure that we're going to talk about as far as the cosmetic procedures is if patients have the exact opposite. That means they don't have too short teeth because of a gummy smile, but they have too long of a teeth because of gum recession.
Okay, okay.
And so this is an example of a young female patient. She was 24 years old, and she basically had...
So on the two, like canine teeth,
yes.
they were receded.
Yes, you can see here that she had on the canines and on the premolars, which are the bicuspids on the corners of her mouth, basically she had receding gums. And you may look at this from a social distance and say, well, this is not that bad of a smile. But for this patient, it was not only a matter of the smile not being attractive because she showed these long teeth in the back. Remember, she's just 24 years old. But also the fact that these teeth had a lot of sensitivity. That means every time she would drink a cold liquid, and here in Texas, obviously, everywhere you go to a restaurant, you get served large drinks with a lot of ice in it. So she could not really drink that to that extent.
So receding gums, and for those people that maybe don't have cold sensitivity, that's where they're headed.
Yes.
Because you're exposing the root.
Absolutely. You're exposing. Receding gums, obviously, at the end will lead to tooth loss once they get past beyond a certain point.
So you want to get in there and do something.
So yes, you want to address this situation as soon as possible, because not only do the gums recede and become more sensitive, they're unattractive, but also they're more prone to cavity development on the root surface.
So how do you do it? I mean, what do you do to do that? You transplant gum tissue? What do you do?
Yes. In these type of cases, what we do something basically gum grafting. And gum grafting can be done in a variety of ways. The majority of patients these days, we use a gum graft that we don't harvest from their own mouth. We used to go to the patient's palate to get gum tissue to use this for a transplant. But nowadays we actually use tissue bank tissue, and that not only gives us the option of doing multiple recessions in one setting, but it's also much more comfortable to patients. And actually, the color match of the tissue bank tissue is much, much better than the one if you use your own tissue.
Yeah, I mean, you can't, in this after, very nice, you can't tell any discoloration.
No, in this case, if it's done properly, and that's the other thing where the training and expertise kind of comes in, and this is what we teach in our courses as well, is that these procedures are done very minimally invasive. We do not just go in and make a big incision, because that's when you end up with scar tissue and tissue unevennesses that then catch the eye. So we actually, as thin as these procedures, as these tissues are, and as fine as these are, we actually tunnel underneath these procedures. And it is an aspect of our specialty which I call periodontal plastic surgery.
Is that
so
right?
It's the plastic surgery subdivision of our specialty.
I had a cosmetic dentist one time told me, he said, Randy, because I asked him, I said, what's the biggest mistake you see in the world of cosmetic dentistry? He says that they ignore the gums.
Yes.
That the teeth are more than just teeth, it's the gums.
Absolutely.
Obviously you share this.
Oh, absolutely, and this is one of the one of the major misconceptions that is out there, both in patients, but also in a large number of dentists. It is that the teeth make up the whole smile or make up the whole end result, and the shape and shade of the teeth. So many people focus on shades and want their teeth to be wider, whereas they need to look at it from a 50-50 perspective. Really what makes up a nice smile, 50% of it is the foundation, is the architecture of the gum tissue and the bone tissue, basically my specialty, and then the other 50% is the shape and color of the teeth, so what the restorative dentists and the general dentists do. And that's why we always, in our specialty, we work hand in hand with restorative dentists.
And you have dentists that go to you. When they want their gums looking good, the word is on the street, right?
Yes.
Kidding around, but I mean, you see a lot of dentists.
Yes, absolutely. Kind of just because of the nature of my practice of lecturing and teaching a lot of the cosmetic procedures, we have developed a reputation for being the practice for cosmetic procedures when it comes to implants.
In your lingo, they call it aesthetic gum surgery?
Yes. In our lingo, as you call it, we call it aesthetic periodontal therapy or aesthetic gum surgery and aesthetic dental implant therapy. And so, yes, we get a lot of dentists that come themselves to me for treatment.
Do they want to be sedated, by the way?
Well,
I always wonder about this.
Yes, that's an interesting question. The majority of dentists that we have treated, because they know what's going to happen, they think, no, I don't need to be sedated, because they think, well, I know exactly what's going to happen, and I'm used to getting local anesthesia and giving local anesthesia, obviously, so they do not want to be sedated. But I'll tell you, almost 98% of these dentists that we treat, at the end of the procedure, they say, I wish I was sedated. And so nowadays when we treat dentists, we tell them this story, and most of them do choose to be sedated.
Seems like an easier way to go. But there's a lot of people with their fear of the dentist keeps them from having the smile they've always wanted.
Yes, and not only does it help those patients who have got a fear of the dentist going in and getting these procedures done, but it's actually medically safer when you're sedated, because when you're sedated, all your vital signs, everything is being monitored, and you're calmer. So for example, in patients who have had heart attacks in the past, or patients who are overweight or have high blood pressure issues, in conjunction with their physicians,
sedation is safer.
Much safer, because it's a much more stable procedure once you're doing it with intravenous sedation.
Now we're just about out of time. You know, great stuff. We talked about gummy smiles, gum recession and what you're doing, cosmetic dental implants for the teeth that are missing in the front of the mouth. Tell me about that.
Yes, cosmetic dental implants are a big part of our procedure, and this is what is something of a passion of mine, because it not only do we see a lot of patients who need this procedure because they're missing teeth in the front part of the mouth. People may have lost their teeth due to accidents, for example. We see a lot of young individuals who have had accidents. Some patients have had accidents as a 10, 12-year-old, and then 10 years later, 20 years later, their teeth all of a sudden start failing. And so we see a lot of this problem, but it takes a lot of experience and a lot of...
But can you match them up, though? The dental implant? Isn't that the problem with dental implants?
Yes,
matching them up?
Yes, and that is where a lot of experience and expertise comes in, Randy. And that's where my passion comes in teaching and in treating these type of patients. Because one of my biggest passions is teaching other dentists to do this correctly, because we see a lot of second opinions if these cases have not been done correctly.
So what could go wrong, briefly, and then we'll talk about what could go right, because you have some photos.
Yes.
But a front tooth, it's showing, what could go wrong with inexperience?
Well, with inexperience, just to simplify, what can go wrong is that not only can the implant basically fail and get infected, that's the most drastic thing that can go wrong. But what can go wrong, what is most drastic for the patient, is that it doesn't look normal. It doesn't appear natural. Somebody looking at you can tell you that's a fake tooth. That is not your own tooth. And that is the most bad thing that can go wrong.
I feel like I could spot people that have something. I don't know what it is, but it's definitely not a real tooth.
For example, look at this this case here. This case here, this is an example of a case that was referred to us because this patient had an implant placed by another dentist.
So that right top tooth, to my eye, is an implant.
Exactly, because it's off. It's asymmetrical. It doesn't match the adjacent tooth. And because this case was done without any planning, it's like you're building a house. You would never build a house without a blueprint. So it's the same thing. Why would you have surgery, especially in an area that's visible, without having a blueprint of how to do it? So in this case, you can see it just catches the eye. So we went in and did a reparative procedure.
So a general dentist sends you this case?
Yes.
They say, you know what, we need Dr. Boltchi for this case.
Well, yes, this case, yes. This case was done by another practitioner who had placed an implant. The patient had gotten the crown and obviously paid for it and everything.
So the patient wasn't happy?
No, but the patient wasn't happy because this was appearing unnatural. Everybody in her circle of friends and family was noticing that this is unnatural. And after we repaired it and we fixed the situation, this has been now about 6-7 years out, and it's still stable.
Yeah, it's very nice.
Yeah, there's no way a person at social distance would be able to tell that this is an unnatural tooth.
No.
And so this is at the lower end of the spectrum, the procedures that we do in the cosmetic zone.
But does it cost more? Like if you want cosmetic dental implants, does it cost more to go to a specialist, a periodontist?
No, and that's the interesting part. Not necessarily. It doesn't necessarily cost more to go to a specialist. The only thing is that the specialist, like I am, we do these procedures all the time. That means I don't.
Like every week you're doing gum stuff.
Yeah, I don't do any fillings. I don't do any braces. I don't do any crowns. All my focus is only on these procedures. And so ultimately, obviously, especially with my teaching background, we focus on these things and we are more trained in them. But no, our fees are not any higher than any other person doing it.
Okay, good. Now you have a really dramatic photo here.
Yes, I want to show you this case because this is not just a case that's very dear to my heart because of the dramaticness of this case, but this patient is a dear patient of mine just because of the emotional story that's behind it. This patient, he is 27 years old.
That's terrible.
And he's a musician, and obviously he has not taken care of his teeth, so he's got a lot of decay issues going on. But basically financially and from a perspective of fear, he never really went to the dentist. And so this patient was referred to us by a general dentist who was actually not this patient's dentist, but the dentist of this patient's mother.
Okay.
And so the mother was trying to get this patient to come and get this fixed. And so ultimately, the patient was referred to us through those sources. And unfortunately, the patient's father had recently passed away. But kind of in a very emotional, heartbreaking sense, the mother was now able to have this done because the life insurance of the father that they had was able to pay for some of this procedure. And now you can see the before and then afterwards. Obviously, we had to remove these bad teeth. But
so these were dental implants?
Yes, but we were able to replace them with a dental implant reconstruction, where now he can go out and now he's playing tours and he's playing...
Looks like a forced smile there.
Well, that's because he's not used to smiling. If you had teeth like he had before, it takes some training to be able to get it, but he's now much more confident. He's actually playing shows.
This has got to be unusual, though. I mean, you don't see things like this. Rarely.
Well, this is relatively dramatic, but we see it in one way, shape, or other, and you'll be surprised how many people have got a variety of this form. They just don't smile and they just don't show it because they're embarrassed. So when you're seeing people, when you're seeing your neighbor, or when you're seeing someone in a restaurant,
they look grumpy. They're just hiding something.
Yes, exactly. It may be that they don't. You say they're grumpy, they're not in a good mood, but ultimately they're basically not just smiling because their smile is not good enough for them. They're embarrassed.
Okay, so cosmetic dental implants, and so if somebody's watching this, they want to find out more. Gummy smile, gums are receding. Do they need a referral from their general dentist? Can they call you directly?
No, they can call us directly, and even if they don't have a dentist, they can call us directly or visit us through our website. And if they don't have a dentist, then we refer them to some of the dentists that we work with for them to take care of that aspect of their situation, of the restorative aspect of it, and then we treat their cosmetic gum problems and dental implant problems in our office.
Well, I want to thank you for coming on the show. Great stuff. Great
information. Thank you, Randy. Appreciate it.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. You can put in Gummy Smile or you can put in Dr. Boltchi's name. For now, I wish you good health.